Welcome, welcome, welcome. Hi, everyone. Welcome to another episode of Let's Talk Money with Friends. Yes, every Wednesday I have the privilege to come to you to talk to you about money, life, and everything else. But on this show, we say money encompasses everything. And that's why tonight, this conversation is very important to me because you all have had somebody who's been impacted by cancer. So it is a privilege for me to have this conversation tonight. According to the American Society, actually American Cancer Society Statistic Center, an estimated 626,140 people are expected to unfortunately die from cancer in the United States each year. That's a lot of people. Those are your friends, your family members, your wives, your cousin. I know I've been impacted, as I said, personally. Health is your wealth. We often put everything else first, our jobs, our families, our responsibilities, until our health begins to fail. The best time to take care of ourselves is now, not after we become sick. So tonight, I am so honored to be able to welcome a community outreach specialist from Dana-Farber Cancer Institute. She's gonna encourage all of us to stay informed, get the recommended health screenings that we need, and take proactive steps to protect our health and preserve our lives. So, without further ado, I would like to again remind you that because this conversation is so important to you and to me, I would encourage you to share because what you share, this show, sharing it today could save a life. And we are looking to do that tonight. So, without further ado, I would like to welcome my guest who's on the line. Her name is Samantha Destine. Samantha, welcome to the show.
Thank you so much, Gabriel. Thank you for inviting me here tonight. And thank you for everyone who's connected with us tonight to learn about cancer awareness, screening, and prevention. And I would like to give a shout out to Curtis Chambers, who connected us this month. Actually, we met at Transitional Remedies, where Curtis usually hold coffee hours every month so community members can be connected together to to better out to do outreach to see how we can help our community in different topics like health, wealth, and many different topics. So I thank Curtis for connecting us together. And again, my name is Samantha Destin, and I work at Dana-Farber Cancer Institute from the Community Health Office. Thank you, everyone, for connecting with us. Please, again, like Gabriel said, please share this live. Talk to a friend, talk to a family member about what you have learned from what you're gonna be learning this afternoon.
Yes, definitely. We have to multitask, right? So I have folks texting me saying like, are they online? And hopefully all the pages are working properly. If you're on YouTube and it's not working, let me know. But yeah, this is important the conversation. And yes, again, thank you, Curtis, for introducing me to Samantha, because of the fact that when we were at that event, we started talking about the different aspects of our jobs. I was talking about one topic and other people were there, introducing themselves. And when you started talking about the work that you do, I was like, wait a second, I need to have Samantha on my show. So thank you again for saying yes to this invitation. So without further ado, I would like to ask you, because when you said you are a community health specialist, what exactly is your job? Can you describe your role as a community health outreach specialist?
Yes, so as a community outreach specialist, big part of my role is to bring cancer education to the resident in Boston about cancer screening and prevention. So rather than people wait for us, like they come to us, we go directly to the local resident to talk about cancer screening on different topics like colorectal cancer, lung cancer, HPV, breast cancer, and different topics as well. Um, and we do this by working with different organizations in the community, such as churches, food distribution site, community health centers, different organizations to help address healthcare disparity that we see here in our community because cancer is making a big impact in our community. So we're trying to lessen the burden. We're trying to provide education and we're trying to bring resources to our community.
Yeah, because so many families and individuals in Boston are not taking advantage of the fact that, we live in Boston. Boston has some of the best hospitals. Dana-Farber Cancer Institute is one of them to help with treatment, and also there's so many others. So for those who are not familiar, because I do live in the neighborhood and I'm lucky to be in the area here where I'm like literally half an hour away from the Dana-Farber Cancer Institute. But I know people have flown and come from anywhere and everywhere, all over the world actually. So what exactly? Why was Dana-Farber established? And also, what is so unique about that institute, and how have they helped advance cancer prevention?
Yes, these are good questions. So, a little bit of background about Dana-Farber. Dana-Farber was established in the 1940s, late 1940s, and the goal was to provide cancer care to children who are affected by cancer. But then later on, in late 1960s, they expanded on the program to provide cancer care and treatment to all patients who are affected by cancer with all different ages. And today, our mission extend beyond cancer treatment. We are also committed to preventing cancer and helping our community with different resources that we have. And the second question that you asked is how does Dana-Farber unique? Well, Dana-Farber is unique in so many ways. First thing is not only we are providing cancer care to our patient, we have researchers that are finding ways to find better treatment for our patient, but we are also investing in our community as well. And one thing I will say about one fact that I would like to share is that every 3 years we conduct a report called the Community Health Need Assessment, which is called CHNA for short. Is a report that again we create every 3 years to learn about the health need, um, concern and strength of the Boston community. And this report help us understand, okay, what people in the community are experiencing and guide our work and priorities for the next 3 years. And so we based from this report, we implemented so many resources, such as the Dana-Farber mammography van. This van go out in the Boston community to provide breast cancer screening for to all residents. And because again, breast cancer is very common in Massachusetts and nationally as well, so that's why Dana-Farber has this van for the community to lessen the burden for the community about breast cancer. And also we have the family bloom van where people can get free skin cancer screening, and we don't even take your insurance for that. We go to local events, we attend we go to different beaches and different uh, health fairs, or we partner with different organizations to bring that awareness. And we have a dermatology on site to answer any questions that you may have, things like that. And so the last question to answer is, Dana-Farber has helped advance cancer prevention, research, and treatment by combining world-class research with patient care and community outreach. So our researchers are working every day to discover better ways to find treatment, to detect, to prevent. And while our community office team are outside in the community providing education, providing awareness to our community. And so together, this effort really help improve the health outcome of our community.
Yeah, thank you so much. This was very
Yeah.
comprehensive. I wanted to say
Yes.
again in my introduction, as I was trying to do so many things, I mentioned that, we neglect our health because we
Yes.
postpone it due to work and family and all the different aspects. So the community,
Mm-hmm.
you going into the community because you know so many people are being neglected their health.
Mm-hmm.
And literally with the truck or the van that you have, you're doing screening on site, which is
Yes,
amazing.
on site.
Yeah,
Mm-hmm.
so what are some of the most alarming cancer trends that you are seeing? Because you just mentioned breast cancer and rectal cancer,
Colo- col-
colo
colorectal cancer.
rectal cancer. So what are some other? Because I was doing some research and I realized that kidney cancer is one, like the top five cancer. Yeah.
Yes, I will say one of the trend that I'm seeing is that again, colorectal cancer. We are seeing colorectal cancer in young people right now. So in a research that we did in 2020, we found that 12% of young people who are under the age of 50 are diagnosed with colorectal cancer. And sometimes it's because of the way we take care of ourselves, we are not exercising, or the way we eat, our diet. So some these are some of factors that research are saying that can cause this, but we don't know for sure exactly. But and another thing is lung cancer. So lung cancer is diagnosed most often in Massachusetts from the community health need assessment that we did this year, and it was released this year that I can share with everyone.
Mhm.
Is that lung cancer is diagnosed most often in Massachusetts compared to the national average. And also, a lot of people are dying from lung cancer in Massachusetts right now. One is because they need to get screened. If you know a loved one, or you know a friend that is like smoking for maybe 2 pack per day for about 20 years, or a pack a day for about 10 years, they need to start getting screened with a low CT dose scan to detect, to see if everything is okay with the lung. So is this factors are very alarming right now, so we need to take care of our health. We need to do the screening on time. And also, one thing that I would like to share is that Dana-Farber has a partnership with Whittier Street Health Center, where we provide um, cancer, tobacco treatment and counseling for people who like to, who wants to quit smoking, or who like to reduce their use of smoking. So we have these resources, and also Massachusetts has these resources as well. So if you want to quit smoking, because again, lung cancer, 90% of lung cancer deaths is related to smoking and secondhand smoke exposure. So make
Yeah.
sure you share that information with your loved ones tonight
Yeah,
for them
definitely
to
share.
get screened.
Yeah, definitely share this information because we are here tonight, not so that we can bring bad news. Actually, this is great news.
Yes, of course, we
And the
don't want to.
reason why it's great news is because we're here because we want to help with prevention and screening.
Mm-hmm,
It's very alarming because I've been doing some research online about this topic, and lung cancer, as you mentioned, it's number one. You know, out of the 600, I had mentioned 626,140 people are expected to not to die this year because
mm-hmm,
of cancer. The
mm-hmm.
majority of them is from lung cancer, colorectal cancer, pancreatic cancer, and breast cancer and prostate cancer.
Yes, yes. Prostate cancer, even now, prostate cancer is affecting white men, black men in our community, and Latino, Latinx community. So our men needs to really making sure that they are doing their PSA testing, to make sure their numbers are good and that they are making an appointment to see their provider about getting tested for prostate cancer.
Yeah.
Thank you
So
for mentioning that.
yeah, so you go into the community, Samantha, and you're having
Yes.
conversation with families, with individuals at different events, including the event we're at the
Mhm.
coffee hour with Curtis Chambers, and you meet all these men and women, and you're talking to them about prevention. And I
Mhm.
know, just like so many, you've heard people saying like, I haven't been to the doctors in years
Mhm.
because I feel fine. I haven't been to
Mhm.
the doctors for years because I don't trust doctors.
Mhm.
I haven't gone to do any screening because I don't have time. I'm working the multiple jobs again. Same
Mhm.
reasons. But at the end of the day, we're trying to prevent that number, that the number, the
Mhm.
626,000, we're trying to prevent that from continuing to happen because that's a
Mhm.
statistic and we're trying to prevent that. What I wanted to ask you, let me, when you go into the community, I just mentioned some of the challenges. What other challenges do you hear beside the ones that I just mentioned?
Yes. Some of the challenges will be being a caregiver.
Oh yeah.
They don't have the time, because they are taking care of their loved ones, and sometimes transportation barriers.
Mm-hmm.
Language barriers. Because most people who immigrate in the US usually don't speak the language and they fear that someone will not understand them while when they call, but sometimes they just don't know that we have a language services that can help interpret, to make that appointment, to someone that can be there to interpret while you are talking to the doctor. So that's why community outreach is so important, because w- we, the outreach specialists, we speak the language that they speak. So I speak Haitian Creole, and my other colleagues, they speak Spanish, they speak Mandarin, Cantonese, so we
So
are providing.
lo renkontre avèk moun yo pale kreol avè yo, vle fò fon ti pale avèk e kominote an pou esplike yo, paske
we
yon pale de pa gen tan. An pil paran pa
we
gen tan, paske yo gon paket ti moun, yo gon paket travay, yo konen. Ou responsabilite moun ki yo gen an Haiti, sütou koun ya pou sa ka pase nan kominote nou an. Moun yo pa gen tan
mm-hmm,
pou ke yo apese wè si yo de ka maksimize potansyel yo pande yo gen ti tan sa ki yo
mm-hmm,
bay yo an, pou yo travay.
we we
I mean, like, nan kominote nou an tou, se pe wè, mba malad, tout ba ok, bon pon ti te. So,
mhm.
how do you go mostly to, because you say you speak Haitian Creole, ou ale particulièrement pou ale adrese kominote yan, ou ale nan tout kominote?
Oui, male nan tou kominote. Male Matapen. Nou konen Matapen gen pi fose kominote Haitien ki la. Male Medford, male East Boston, male Hyde Park, wazen de diferent kote ke m ka pale avek kominote Haitien nan. Ou kompran? Nou pote informasyon, nou pote ressources bio tout,
Hmm.
de tout ça que nous t'ai dit tout à l'heure, de mammographie, bus mammographie, hein, un bus qui a porté information sur concernant peau, toute
Hmm.
information ça va nous porter ba yo, et puis tout nous dit qui à qui là je t'as supposé faire un test yo, comme si un test colonne, cancer dans
Colon.
colonne,
Hmm.
cancer dans poumon, cancer en matrice yo, tout ça. So nous ba yo toute information ça pour yo ka connaître. Et pour répondre à la question tout à l'heure, comme si, comment on parler avec communauté haïtienne dans les audio pas gain temps. Un bagay pour nous comprendre, c'est que les nous pas créer un petit temps comme ça pour tête nous, et et investir nous investir dans tête nous, les nous faire sacrifice là. Nous comprenons nous chaque ka pa gen tan. Mais fè sakrifis lan, paske nou tout, nou gen moun ki depan de nou. Nou gen yon fami, nou gen zami, ou swa fami nou ki Haiti, men si nou pa gen fami bo isit, nou gen fami ki depan de nou Haiti, ou swa lòk kote ki depan de nou pou nou voye l'ajan, ou swa nepot sa liye. Sa ve di, lè ou fè test dépistage pou kanser, son investissement ou fait pour futur parce que les ou fait test lan bonheur et les ça cancer pi bien traité bonheur.
Yeah.
OK, ça veut dire li important en pile pour nous faire test yo à l'heure yo recommandé lan parler avec docteur nous et puis si nous pas gen temps vraiment gen des fois nous juste à supposer transparent ensemble avec docteur nous parler dit mais comment schedule moyen mais comment à qui l'aime travail même si docteur a pas ka aider mais li ka référer avec un autre docteur qui ka aider.
Yeah, it's very important to make the time. Thank you so much for explaining that in our native tongue, because I know
Yes,
many of my
important.
followers are Haitians. It's very important to make the time because I know for me, this year I got so busy in the beginning of the year. Usually that's when I do
Mhm.
all my screenings, and I got so busy because of the tax season. Of course, I canceled a couple appointments that I had to take later on. But I'm making a point to make them happen this year. But it's so easy to just want to cancel your appointment. Your
Mhm.
the screening for your breast, you cancel that. For men,
Mhm.
prostate cancer is huge. You can
Mhm.
feel the symptoms, but you're saying like, oh, there's nothing wrong with me. And the longer you wait, the worse it gets. So
Uh-huh.
we care about
Exactly.
you. Let's Talk Money with Friends is all about community. And that's
Mhm.
why when I hear great information, I want to bring it to you. That's why I want to encourage you. If you are watching this, please do not keep us the best kept secret. You go out and do a community outreach because most people are not going to come to Dana-Farber, even though it's down
Mhm.
the street from them. All the communities that you just mentioned, they're literally 20 minutes away from your main office, right? The main hospital.
Yes.
But most
Yes.
people will not
20 to
go.
30 minutes. Mhm.
Yeah, they will not go. That's why Dana-Farber is coming to the community. We are coming to your home, your computer, your tablet, your cell phone. Please tag, share, and make a comment. Let your friends know that this is important because I do believe tonight, if you give if someone an incentive to go get the screening done by calling their doctors tomorrow, guess what? You could save a life. Because I know a friend of
Exactly.
mine who told me she was gonna leave a job. She went in to do a screening and then find out that she had cancer. So it happens every single day. I have a personal experience with my own cousin who died actually 8 years ago. September is gonna be 8 years of breast cancer because she went for the screening. By the time she went, it was already too late. She was like
Wow. I'm
stage three
sorry.
or four. Okay, so we don't want that to happen to you, and that's why I make an effort for myself, and I want you to make an effort for yourself. So, is there any other like when we talk about the importance of community partnership? I know you were at Curtis Coffee Hour. Are there other organizations? Because you mentioned many organizations here, and I know they're
Mhm.
fighting for so many things for the community. But do you partner up with them as well to bring information? Because that collective, like the churches and because on Sunday morning they're all there.
Yes, yes.
And like those organizations that are helping with immigration, I went to a meeting the other day. The place was packed,
Mm-hmm.
and these folks are under stress. And by the way, I remember I used to do the walk for cancer,
Okay.
and one of the major primary causes they said was stress. So how do you partner up with community partners to be sure that you bring the information to them, like other organizations and churches?
So first thing first, we try to understand, okay, what the partner needs. Because sometimes they are not at the right space to partner with us or collaborate with us.
Mm-hmm.
Sometimes we make the call, but we try to understand where they're coming from, if they have like the same goal as us. So that's one thing. So we partner with churches, we partner with food distribution site, we partner with school, um, we partner with community health centers. So we usually will host a tabling
Mm-hmm.
or we can host a education session. The education session will be just on one topic, talking about what is colorectal cancer screening, for example, and then give information about what symptoms that you need to look out for, some risk factors that you need to look out for, and more information about colorectal cancer. So we're trying to make sure, again, if they have that space for us to understand, if we have the same goal to lower the healthcare disparity in our community. Because from the research that we did, from the community health need assessment, we can see that there are some big differences in some community more than others, in housing costs, on food insecurities. So that's why we try to go to these neighborhoods that are affecting the most, trying to bring those resources and trying to educate those who are affected the most on healthcare, on disparity.
Yeah, you talk about the health determinants of the
Mm-hmm.
housing is can impact because the stress of housing. Many
Mm-hmm.
times I've seen it because I work in community where people postpone certain procedures. They postpone going to the hospital or going to see their doctors because they're fighting an eviction. They're fighting a foreclosure, or they're unemployed. All that can really take a toll on an individual. It creates stress and also a sense of like, I don't have time for this. This is not a priority right now.
Mm-hmm.
Priority is
Yes.
having a roof over my head. So
Yes.
definitely, we want to let everyone know that we know what you're going through, and whether you are
Mm-hmm.
high paid professionals, because there are some companies. I've seen high paid professionals. People are making a lot of money, but they're not going to the doctors because guess what? It's so the environment makes it impossible for you to take time off. It's not only
Mm-hmm.
those who are working essential jobs or working jobs that are low pay, low income or low wages. Folks who are in high level position, and you hear like unexpectedly, oh, this person died unexpectedly. Many times it's because they have delayed issues that they never take initiative to take care of, and now that situation is out of control and it's too late for them. We don't want anything to become too late for you. That's why tonight we having this conversation. Community health advocacy matters, and I'm so glad Samantha Destin. She's not a doctor, but Samantha, I see you had a title MHA. What exactly is that?
It's a master in healthcare administration.
Okay, Master in Healthcare Administration. So you learn how
Yes.
to help communities and getting them
Yes.
to understand the importance of good health. And
Exactly.
right now
Yes.
you're doing that through Dana-Farber Cancer Institute. Yeah.
Yes. Mm-hmm.
So is very important tonight. For me, I wanted to have this conversation, and because it's so important. So what is the message of hope? because I know the other day I was watching something and I heard that, as you said, the diagnoses are happening in younger and younger patients. What is you had mentioned diet and everything. What message do you hope everyone lives with here tonight?
The message that I hope everyone leave here tonight is that we need to talk about cancer. Don't make it so if you're going through the cancer journey yourself,
Mm-hmm.
don't do it by yourself. Talk to a friend, talk to a family member, and having that conversation, be open because family history is a big risk factors on people who are getting cancer right now. So don't hold that in. Share that information with your family members so they can get screened earlier, you know? Um, and also, if you're going through this cancer journey right now, or you know someone that's going through it, there are so many resources out there for you. For example, we have health navigators that can help you find resources on food, on housing, and we also have social worker oncologists that can help you find resources on mental health and physical health, so you don't need to do this alone. That's what I want to leave with everyone here tonight. And also make sure you talk to your primary care provider. Sometimes when we go to the doctor's office, we talk about other things. I mean, they are important, but we forget about doing the screening. So men needs to do their PSA testing to check if their prostate are okay. Women should start begin screening for breast cancer with a mammogram starting at the age of 40. So if you have a family history, then you should start begin screening earlier than 40. And all everyone needs to get started doing their colorectal cancer screening starting at the age of 45. So if you have genetic factors or some other risk factors, then you need to get screened earlier than 45 with a colonoscopy. So share this live, share what you learned tonight about getting screened. So that's what I will leave with everyone tonight. Just talk to your friend, to your primary care doctor, and don't go through this cancer journey alone. There are many resources for you out there.
Yeah, don't do it alone. It definitely is very taxing on the spirit, body.
Yes.
You need the support, but we wanna really help with prevention. And we know
Mm-hmm.
tonight what we wanted to do is talk to you all about the importance of taking care of yourself. Now, before we go, I wanted to go back again to the idea of good health, creating like the exercising and the eating habits. What are some of
Yes.
you mentioned food and security. Food is very expensive right now. And we have folks, sometimes they come in from work, certain environments they don't even give you time to eat healthy
Yes.
because you work in
Mm-hmm.
12, 16-hour days. By the time you get home, you don't even have time to eat healthy. How would you encourage someone who finds themselves, I know there are some of you right now who are working two jobs and also have, or maybe have a one job but it's 12 hours. What
Mm-hmm.
are some of the best practices you think that they could take advantage of in order for them to avoid the fast food, the processed foods, and also staying healthy? Or even like before we started the show today, we decided like we're gonna stand up and stretch because I'm
Yes.
gonna be sitting here for an hour, for at least 45 minutes. Let me stretch before. What are some of the
Mm-hmm.
ways to keep the body and um, in terms of like nutrition, great
Yes.
nutritional habits?
So I would say first of all is to make small changes every single day
Mm-hmm.
because changes are not gonna happen just like that. So make small changes. There are farmers market in
Mhm.
almost in every neighborhoods.
Yeah.
They make it easier. You can, if you have some SNAP program or EBT card, you can
Mhm.
buy um with at a lower price that help you, you know, help your
Yes.
friends, help your family members getting a discount of buying fresh fruits and vegetables. And there are so many programs out there that provide resources on I'm not sure if I can share them here on live, but there are so many resources out there that provide food resources for everyone in our community that are facing food insecurity, you know. So, but one thing first is making that small changes. It's not gonna be happening overnight. That small change then can develop into something bigger later on.
Yeah, I had a couple people who are texting some questions about. I know you mentioned like taking care of families, but single people, those who do not have families, typically have a tendency to delay. Do you see there is a, I mean, we talked about men and women and different cancer that impacts each one of them differently. What about like your marital status? Because I've heard they said married men ended up living longer because they have a spouse reminding them to go get
Mm-hmm.
screening, reminding them to follow
Yes.
through on their medical appointments. Whereas single people don't usually. What are some of the things that single people can do to kind of hold themselves accountable, or each other or other friends who are single accountable?
um I will say friends. If you do have friends, then I'm sure like they will want the best for you. And
Yeah.
also there are so many groups out there. Sometimes there are groups out there that focus on health, on wealth, on different topics,
Yeah.
and you will find someone in that group that will be talking about health. They will be talking about their journey on, maybe on diabetic, you know, on different things that are happening in their life. So when that person shares something with you, then you'll be like, oh, I need to do this myself. I need to be hold myself accountable for it. And also one thing that I would like to share, that's why the outreach team is going in the community, you know, because of everyone, because not everyone is, because most of the time when I host a tabling session or um, education session, someone will come up to me and said, at the end of the session, someone will come up to me and said, "Oh, I wasn't aware that family history plays a big part of having cancer." You know, so having that conversation with me, then you held yourself accountable to do the screening. You know, the next step is to go to your primary care provider. So that's what I would say for the single people out there.
Yeah, thank you. This show is about carpe diem. Last week we talked about the time is now, to take advantage of
Mm-hmm.
the time now. So tonight you heard it. Take
Yes.
care of yourself. Do not wait until it's too late. We don't want to hear the stories that we've been hearing all over the news. You know, younger people, younger and younger, are not surviving cancer because they are going to the doctors. They're going for screening a little bit too late. We want you to catch it early, or we want you to prevent it altogether. And the way you do that is definitely have somebody hold you accountable. Exercising is not easy. Today it was raining in Boston. I didn't get to do any exercise, but guess what? I can go up down the stairs and try to do something, right? It's not
Yes.
easy, but if you do 2 3 days a week, because again, when I was doing the annual, I kind of stopped doing that several years ago, but I was doing the annual walk for cancer.
Mm-hmm.
Every single like they had like signage like throughout the trail that we were going down. They talk about like stress is the number one. You know, you gotta avoid
Mm-hmm.
stress. If you're in a stressful relationship or stressful
Mm-hmm.
environment, you gotta protect yourself, because your health
Yes.
is your wealth.
Mm-hmm.
Nothing
Yes.
else is important. You know, no,
Yes.
nothing else is important when you don't have your health, right?
Yes.
And then you
And
go ahead.
mhm. Yeah, one thing that I would like to share when you say about the exercising, like you go up and down the stairs, that's one way too. But there are some YouTube channels that you can connected to. It's called walk at home exercise. You just stand and make some movements, you know. You don't need to go outside if it's like raining or if it's snowing outside. You can do those exercise at home to stay healthy, at least 30 minutes per day. That's what the CDC recommend for
Yeah.
everyone to spend at least 30 minutes per day to stay active and to stay healthy,
The 20
you know.
minute 20 minute
30 minutes.
30 minutes. Okay,
Yes.
so 20 to 30 minutes you gotta do something active to for prevention. It's very important. And then
Yes.
your eating habits, right? Be sure that
Mm-hmm.
you're eating at home. Restaurants fine, but you gotta make sure that most of your dietary intake coming from
Yeah.
home, and that you're not
Mm-hmm.
eating breakfast, lunch, and dinner at the fast food restaurants, because again that's a big part of your health, right? Of what would
Yes.
become of you. And also, if you
Yes.
find yourself, you had mentioned, don't do it alone. Don't do it alone. That's why we talk about community matters on this show.
Mm-hmm.
Everything you need community. I know for me,
Yes.
community has been very important for me.
Mm-hmm.
Friendship and the people that are in my life, it's very important that you make sure that you let them know what your goals are. Like the other day, I was talking to my sister. I'm like, you know what? I would like to work out on, losing a little bit more weight. And she started giving me a list of things that I could do. You gotta
Mm-hmm.
let people know
Yeah.
what your intention is, and then let them hold you accountable, because it's very important that we do that. Dana-Farber
Mm-hmm.
Cancer Institute does the treatment, but because they
Mm-hmm.
know, we were saying that offline, right? They do
Yes.
treatment because they were a hospital, but they're trying to limit the number of treatments, right? They're trying to make sure that we get the prevention done in order to avoid
Exactly.
the numbers that we have. As I said, 626,000 people are gonna be diagnosed this year, plus, and many, and they're not gonna make it. They're
Mm-hmm.
not gonna make it. Anything else you would like to say before I close tonight?
Yes, again, thank you so much, Gabriel. And one thing that is to eat more fruits, more vegetables, eat less red meat and less processed food, because these help with reducing cancer risk, colorectal cancer and other type of cancer. That's what research said. So, and also try to limit alcohol
Hmm.
and to smoking, because both alcohol and smoking has been linked to increased cancer. So again, make small changes every day. If you drink all like 2 glass of wine per day, maybe you can drink one per day, but just try to limit that, so you can lower your risk of cancer. So that's one thing I would like to add to, when we are talking about exercising and eating habits and things like that.
Yeah.
um
Can I just say, since nous parlons de langue, ou capable de dire ça en créole tout, pour moun qui
oui.
déjà, yeah.
Oui, mwen ta vle di nou tout komunote Haitienne nan nou ta pale de koman pou nou suppose manje. Nou ta suppose manje plus fruits a légumes. Eseye pa manje an pil viande ki rouge yo. Sa vle di viande cochon, viande bœuf, viande cabrit. Eseye limite sa yo paske eh, sa recherche montre ke manje viande ki rouge yo chak tan kon afekte kom si pou gen risk pou kek kanser. Kanser nan kolon nou avek lot kanser tou. Sa vle di eseye limite yo, eseye limite jan nou bwe alkol, du vin rouge, du vin blanc, bière, liqueur, eseye limite jan nou bwe sa. Gen de fwa nou kon bwe pa okasyon, nou ka yo rekomande pou fi suppose bwe 4 boisson pa okasyon. Sa vle di lem di okasyon kal nou fet, ou bwe fi an ka bwe 4 boisson. S'il depase sa, eseye limite sa. On kompren? So, bwe trop alkol, kom si, sa vle di 4 boissons par occasion. C'est pour filles et pour garçons, c'est 5 ou plus boissons par occasion. Ça veut dire, essayer limiter gens à boire alcool parce que là, pour filles, on boire 4 ou plus boissons par occasion ou augmenter risque pour gagner certains cancers. Ça ne veut pas dire ou pral gagner cancer peut-être ça, mais essayer limiter gens nous à boire
Yeah,
pour
gampi
nous
mon
kembe vie nous en santé.
yeah. Gampi mon ki di I'm capable I can hold my liquor. So that you bring pile tafia parce que you you're capable to hold the liquor. Even if you can
Mm-hmm.
hold your liquor, my friend, do not do that. Do not drink
Yes.
too much because it's gonna impact your health. Because
Mm-hmm.
your body and I'm I have to say I'm so glad that I grew up in an environment where we were told that to abstain from cigarettes and abstain from drinking too much. Nje
Mm-hmm.
kon pon ti liquor no avec ti what do you call it, cremas. But
Oui, crémasse. Mm-hmm.
drinking beer every day was not something that I grew up doing. So I
Mm-hmm.
really never had that as a risk. And I don't even
Mm-hmm.
eat I don't eat red meat. But at the same time
Okay.
too, a lack of exercise, working too much
Mm-hmm.
and not giving
Mm-hmm.
yourself the time to go
Mm-hmm.
out to exercise. I know I've gone
Mm-hmm.
up and down my weight because of stress,
Mm-hmm.
because of other related issues. So it's very important to encourage you tonight to make a decision. You
Yes.
can get up today and do something. Again, I would like to say, I'm closing here. I would like to say thank
Yes.
you for joining us tonight and for
Oh,
sharing your
no.
knowledge and
Yes.
experience because I know you do this out of, you were so passionate last time I saw you. That's why I'm like, I gotta have you come here. And
Yes.
Advocacy is our community and other communities because you're bilingual. You are able to express this knowledge in Creole, en Creole et en anglais. So, pas de excuse, ok? Et
Oui,
show
pas
ça tout.
d'excuse.
Yeah, show ça tout pour communauté moi parce que je parle Creole, but aussi too, I speak English, so it's for other communities as well. Some of my friends don't speak Creole, so that's why we make sure we do the show in English so they can understand too.
Yes.
Health advocacy saves lives
Mm-hmm.
actually. It's saving a lot of lives because when we go out there and talk to people about prevention and they take action, it's really important.
Mm-hmm.
So every conversation, every screening, and every person we encourage to seek care has the potential to make a difference. It has the potential to make
Yes.
a difference. So this information tonight, it's for one person, it's for everybody. Okay?
Mm-hmm.
See your doctor, and we encourage you to talk to your loved ones to do the same.
Yes.
Okay?
Yes.
Because your success is our success. If you stay
Yes.
healthy, it'll be good for you. You'll get to raise your kids because you're not
Mm-hmm.
gonna go at 51 or 41. And also, you get to
Yes.
stay with your family. We say now, take action. The time is now.
Yes.
So yeah,
Yes.
I just wanted to say again, thank you. If you have any
Oh,
questions, how do they reach out to you if they have like church like a community center and they
yes.
would like to have you come in and speak?
They can reach to me via email. I can share that with you, and I
Yeah,
don't
you
know
can you
if.
can kind of say it to everyone. Yeah.
Oh, okay. It's Samantha underscore Destin and at DFCI, D as in David, F as in Frank, C as in cat, I as in igloo, .harvard.edu.
Yeah.
That's
Okay.
how you guys can
Say
reach
that
out
one
to
more
me.
time.
Yes, it's Samantha, Samantha underscore Destin, DEST as in Tom, IN .DFCI.harvard.edu.
Yes, definitely.
Yes,
Please reach out to Samantha Destin because she can help you and help your community. And next time I go to an event, I'll probably see you again.
yes,
Reaching out to the community. It's very important that we take care of our health because guess what? Your health is your wealth. Please tag, share, make a comment, and also, yeah, we'll be here next week for
thank you.
another.
Thank you so
Yeah,
much,
thank
Gabriel. It was a pleasure to be here. Thank you everyone who are connected with us right now. And it's a pleasure to share that information with everyone. And please, everyone, do your screening, talk to your primary care provider, making sure that you are getting your screening done. So again, thank you. It was really a pleasure to be with you all.
And thank you for all of you for watching tonight. Have a blessed night. And we'll see you again next week for another episode of Let's Talk Money with Friends. Today is one of the very busy days, but I'm so glad I was able to be here. And I'm so glad that every single person who's listening to me, who has not done, again, we don't want to keep lingering on this, but please go get it done because we see it happening to our friends and we don't want that to happen to you. God bless
Yes.
you.